Cellular adaptation refers to the reversible structural and functional responses to non-lethal changes in the cellular environment, during which new but altered steady states are achieved, allowing the cell to survive and continue to function. The types of cellular adaptation include hypertrophy, hyperplasia, atrophy, and metaplasia. Hypertrophy refers to an increase in the size of the cells and the affected organ in response to increased functional demand. It may be physiological, as with skeletal muscle hypertrophy during exercise, or hormone-induced uterine hypertrophy in pregnancy. Or it may be pathological, as with concentric left ventricular hypertrophy due to chronic hemodynamic overload in hypertension or valvular disease, or compensatory hypertrophy due to destruction of a paired organ, such as the kidney. In principle, increased functional demand results in stimulated cell signaling mechanisms, leading to increased synthesis and assembly of intracellular structural components. Consequently, there is increased cellular and concurrent organ size, as well as functional activity to a point. Once this point is reached, further hypertrophy becomes maladaptive, such as in the case of heart failure due to concentric left ventricular hypertrophy. Hyperplasia refers to increase in the number of cells in a tissue or organ in response to a stimulus. Of note, it only occurs in cells capable of replication, i.e. DNA synthesis. In these cells, hypertrophy may occur concurrently with hyperplasia. Hyperplasia may be physiological, such as with hormone-induced proliferation of the glandular epithelium of the female breast at puberty and during pregnancy, or compensatory hyperplasia occurring in the liver following partial hepatectomy or in red blood cell precursors following acute hemorrhage or hemolysis. It may also be pathologic, as with benign prostatic hyperplasia or papillomavirus-associated epithelial hyperplasia in skin warts or verruca. Atrophy refers to a reduction of cell size and number in response to decreased functional demand, reduced stimulation, or diminished nutrition. The rationale behind it is that the decrease in size of the organelles results in reduced metabolic needs of the cells, establishing a new equilibrium that may be sufficient enough to permit cell survival. Atrophy may be physiologic, such as with atrophy of embryonic structures, such as the notochord or thyroglosal duct, uterine atrophy following pregnancy, or atrophy of the endometrium, vaginal epithelium, and breast at menopause. It may also be pathologic, such as in the following cases: disuse atrophy in chronic bedridden states, denervation atrophy due to nerve injury in motor vehicle accidents, diminished blood supply in cerebrovascular disease or due to compression by an adjacent tumor, diminished or inadequate nutrition in cancer-related cachexia, decreased endocrine stimulation in secondary hypoadrenalism. Atrophy is facilitated by decreased protein synthesis and or increased protein degradation. The latter occurs via the ubiquitin proteasome pathway or autophagy. Metaplasia refers to a change in the expressed cellular phenotype in response to chronic physical or chemical irritation. It results from reprogramming of stem cells that are known to exist in normal tissue or of undifferentiated mesenchymal cells present in connective tissue. Principally, it is thought that the replacing cell type is better able to withstand a new adverse environment. However, the protective functions of the prior epithelium are lost, and the metaplastic epithelium is prone to neoplastic transformation. Metaplasia may be epithelial or mesenchymal. Epithelial metaplasia is most commonly encountered and includes several different types, such as intestinal metaplasia, as occurring in Barrett's esophagus, or H. pylori-induced chronic gastritis; squamous metaplasia, as in the respiratory tract due to cigarette smoking, or in salivary glands due to stones. Osseous metaplasia in myositis ossificans is an example of mesenchymal metaplasia. For physiology, pathophysiology, or pathology, be sure to like the video, subscribe, and follow us for more.